Please come on through. Hello, lovely. Come on over and just take a seat there for me and I'll be with you in a moment. All right, thank you. Okay. You can just go through your profile a moment. Okay. Right, that's fine. So I saw you about a year ago for a mental health check and a health check, is that right? Okay, I'm going to do the same again today, alright? Okay. So, I've had a note, and it's from one of the receptionists. They said that you called and they spoke with you and they were quite concerned about you because of the way you were feeling. Yeah? And that's why you're here with me today. Okay. So, I would just like you to tell me in your words how it is you are feeling. Just give me exactly, be as raw as possible, okay? It's in a safe space and you've done the right thing by coming here today and to open up, alright? It's so brave, you should be really proud. And it is the first step, alright? Good. When you're ready, okay? Yeah? Okay. It's quite depressed, very low mood. Sadness. Are you crying a lot? Any reason, or is it just any time about anything? Yeah, okay. Okay. Lethargic. So would you say quite fatigue? So what about your sleep? Are you managing to get to sleep okay? Hit or miss. What about through the night? Are you staying asleep, or you been, waking up easily, or? Okay, so it just depends. Right. What about in the morning? You feel like you can't get up. Yeah. So you're not feeling refreshed at all. Okay. 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 Do you know if there's anything that has triggered this? Right, so nothing in particular. So you feel a little bit anxious too? Okay. Have you had any panic attacks at all? Right, okay. Alright. How long have you been feeling like this? A couple of months. But getting worse, yeah. I was just about to say, do you think it's escalated? And quite quickly? Alright. So I see at the moment you're still not on any medication for your mental health, and that's been over a year now, which has been really good. I know. These things happen when we are ones that struggle. We can have relapses, always, it's up and down. Some people just have bouts of things, and then other people, it's just literally like a roller coaster. Yeah, I know, but we'll work through it. Okay, we will. Don't put yourself down about it. That's not going to help. Yeah? Alright. So, have you been experiencing any physical symptoms? Okay. Yeah? Okay, so the aching, things like that. Has that been like continuously on and off? Right. But you feel well in yourself? Yeah. It's fine. And you're suffering with a little bit of headache here and there. Probably more than you should. Yeah. Alright then. this time last year, you were not too bad actually. Never experienced SAD, seasonal affective disorder, that I'm aware of. It doesn't say it on there. I know when you suffer mentally anyway, it's a little bit difficult to differentiate the two and things like that, but you're more prone and easily triggered by this time of year, okay, with the weather and things like that, and the dark days, because it is quite gloomy at the moment, wet, windy and dark early and quite dull and dark all day. It just doesn't help our mood, and then we're not getting enough vitamin D and things like that. Okay, can you just tell me how your diet is at the moment, please? Okay, but please make sure you do eat, okay? Don't starve yourself, alright? Try to eat little and often, and make sure you drink plenty of water. Yeah, at least. Okay. So I want to pop you on the scales, if you don't mind, just over there for me. Thank you. Okay. Can pop stuff down. Just check. Okay. We have lost a little bit. That could be through how you're feeling. Could just be a gradual thing over the year anyway. Okay. When did you last see a psychiatrist? Some time ago. Same for psychologist. Okay. That's fine, don't worry. Got a couple of these sheets that I need to do with you. Alright. Before I do those, I'm just going to do a few basic little checks, alright. I do want to give you a blood test today as well. Check for vitamin D levels, iron, full blood count, check your hormone levels, just see if we're lacking in anything, okay. Right, are you comfortable? Okay. First of all, can I just take your pulse, please? Yeah, I'll take it from the wrist, okay, thank you. Okay, can I check your neck actually? Okay. I need to listen to your chest, your heart and lungs, okay? If you could literally just raise your top for me. Thank you. Will feel cold? Okay. And take a deep breath in for me. Release. Take a deep breath in for me. Release. Take a deep breath in for me. And release. Take a deep breath in for me. And release. Okay, you can put your job down. So your pulse is a little bit on the fast side, and your heartbeat is a little bit fast too. Could be a bit of nerves though. Alright. Have to do your blood pressure. I'm going to do this side. Put your arm out like that for me. I'll go quite tight, okay? I'm just going to do that again, okay? Okay. Blood pressure's on the higher side, okay. Again, that could be nerves. Just to do with all the anxiety and things you're carrying around with you. Okay. Just going to have a little feel around your glands, okay. Just tell me if you feel any pain. Open wide for me. Okay, close for me, thank you. All I need you to do is just continue to look at me. I'm going to literally look in the eyes, then I will get you to move your eyes in different positions. Okay, great. Okay. You're doing really well. Okay, follow the light to your eyes. Okay. back at me. Up with your eyes, please, only. Thank you. Okay. And down, just with your eyes. Thank you. Okay, relax. Look that way. And that way. Okay, and back at me. Eyes looking really healthy. Okay. Alright. I'm going to have to put my apron on now, okay, because I'm going to just take some blood. Alright. Feeling okay? Alright, you're doing really well. It's a different one actually. What's this one? Yeah, so I'm going to have to do obviously a full blood count, alright. I'm going to check for iron levels, vitamin D, some hormones, alright. And just see if you're lacking anything else. Yeah, okay. Can you remember which arm's better for you? Not sure. Okay. Okay, if I could just have a look in both arms first, thank you. Just pump like that for me. And a bit more. Let's stop. Let me check this one. Can you pump? Okay. Okay, stop. I think this side's actually better today. We'll give that a whirl. Okay, I'm going to pop this round. Okay, let's see if I can make it tight. Just make a fist for me. Okay. Okay, keep pumping like that for me, that would be really good. Okay. Okay, let me just look. Oh, that's perfect. Let me just clean this. Okay. Okay, if you can stop pumping for me. Right. Just going to take that off. Okay. Just relax for me. Okay, right. Feel a sharp scratch. That's it. All right. Okay, next. Last one. Do really well. So we hold there for a moment. Okay, just keep that there. Okay, would you just hold that for me? Yeah, make sure you press quite tight. Can we just have a look? Just a little bit more, I'll do it for you. I'll do, it's fine. Just put this on. There we go, wonderful. So, two right on that bottom. Okay. Okay, so that's 3 bottles that need to be sent. Perfect. Just bear with me a moment, okay? I'm just going to print that off. Okay, let's put that to the bottles. Okay, so that's all your blood sorted. Okay, so I'll get them sent off ASAP and the results will come back to me. Okay, but what we could do is get you some vitamin D possibly. Okay, that's what I'm thinking we could do. But I just need to check those bloods first. If your iron's low, I will give you some iron tablets too. Okay, so I'll just put that as a possibility. Okay, so I'm going to quickly go through this sheet with you, okay, because this will help indicate a little bit more. Okay, so this is based on the last 2 weeks. Okay, so over the last 2 weeks, how often have you been bothered by any of the following? Okay, we've got 0, not at all. Several days is 1. More than half the days is 2. Nearly every day is 3. So you can either tell me the number or say what I told you. Okay, so little interest or pleasure in doing things. Feeling down, depressed or hopeless. Trouble falling to sleep or sleeping too much. Feeling tired and little energy. Poor appetite and overeating. Feeling bad about yourself or that you're a failure and let yourself and family down. Trouble concentrating on things such as reading the newspaper and watching TV. Moving or speaking so slowly that people could have noticed, or the opposite. Okay. Thoughts that you would be better off dead. Okay. Self-harm thoughts. Suicidal thoughts. Okay, I'll just add that up. Okay. Okay, next. Same again with the numbers. Feeling nervous, anxious or on edge. Not being able to stop or control worrying. Worrying too much about different things. Trouble relaxing. Being so restless that it is hard to sit still. Becoming easily annoyed or irritable. Feeling afraid as if something awful is going to happen. I'll just add that up for you. Right, okay. I'm going to see, looking at this and everything that you've told me and how you appear to me today, I feel it's appropriate to diagnose you with SAD, okay, seasonal affective disorder. Oh, no, sweetheart. Shh, it's all right. Oh, okay. Shh. Slow down. Shh. It's okay. You're here. I know what's happening. Treatment can start, okay? So your recovery can start. And you're not a failure at all. You're so brave that you've come here today and told me how you feel. You really are. Everything will be okay, you know. I assure you. Keep pulling through. I know how hard it is. I really do. So, I don't want you to worry. Okay. I really do think you're lacking vitamin D. Okay, or possibly even iron. So that is going to help as soon as I start giving you some of those. Okay. But it is, you know, perfectly normal. A lot of people suffer with SAD. Some people experience it sometimes and not others. And then there's people that suffer with mental health issues anyway, and they're at high risk of developing things like SAD and things like postnatal depression, etc. Okay. Yeah, it is very common. And that's what's happening with you at the moment. Yeah, I would like to give you a prescription today of fluoxetine. Okay, I'm going to start you on 20 milligram. Okay, that's an antidepressant, but it's also really good for anxiety. It's an SSRI, okay. Try that first. I think you had one of these a long time ago. I'm not 100% sure. I think I saw it flagged up somewhere. But I'm going to try you on that and 20 milligram. Okay. You need to give it about 4 to 6 weeks. If you do need something stronger, we could change over to a different antidepressant. Okay, but I just want to start with this one first and see how we go. Because obviously when you start using other kind of antidepressants and different mental health medications, they're all different types and some, you know, quite stronger and different things like that. So this is the best place for us to start. Okay. Yeah. then I would need to see you for a review in 6 weeks. A review. And we can see how you're going with the medication, and I may need to up it to 40 milligram. Okay, that's a potential what we'll do. I'll mainly give you, as I said, vitamin D and iron. I'm also going to issue diazepam, 10 milligram. I want you to take 10 milligram morning and night every day for 2 weeks. Okay, good. And obviously we'll chat about that when I see you in 6 weeks. We may need to issue some more. Just have to wait because they are very addictive, okay? So we just need to pace ourselves with medication like that. Okay, I don't want to give you anything for sleep. I feel that the diazepam will probably be enough to help you at the moment. Okay, I don't want you getting hooked on sleeping pills again. Okay, yeah. Especially if we're feeling sluggish and things like that as well. I don't really want you to be feeling worse. Because sometimes when you have sleeping pills, when you wake up, you still feel really drained and sluggish, and that's not going to help the situation when you're feeling like that already. Okay, so I'll do that prescription. And that prescription. Indeed. Okay. Okay, so that's that. Okay, so there's your prescription. Okay, thank you. And what I want to give you is just some information. Okay. As well. Would you mind if I referred you to a psychologist? I don't want you to see a psychiatrist at the moment because I feel that we're okay to manage it where we're at. Yeah, okay at the moment. Yeah, I think so. Yeah. But then I would like you to see a psychologist because I think it's really good for you to talk to somebody that is specially trained, okay? And they can give you like techniques and how to help you more than the things that I can, help you with and that I can tell you and give you and things like that. Yeah, they might offer you some CBT and things like that as well, but we'll see, okay, what it will be like. And if things do escalate, we'll probably have to get you sent to a psychiatrist, possibly look at some stronger medication. Yeah, okay. Some little things that you can do at home, okay? So I'm going to give you this information leaflet. So, this one is about SAD itself. As you can see what the diagnosis is, tells you about it, and different ways to deal with it and things like that. All sorts of different things. So that's information that I think you need to read. Okay. And then the other one is this one. And this is just a little bit of help and advice for you for what you can do at home. Now, some of these are not going to change your life. They're not going to get rid of the mental illness, okay? They're going to try to help relax you and calm you, okay? So, in here you'll see a picture of a salt lamp, which I highly recommend you purchasing one, okay? Or a light therapy light box, okay? And then you can have that on so long a day. Try and sit next to the windows as much as possible. Try and go out for a walk once a day. It doesn't have to be very far, but just try to get outside and get some air and sunlight onto you. But the light boxes are really good. Or you can buy these alarm clocks, and they've got lights. They start dim, dark, bright, and really up, and then get you up that way. Okay, and then there's one where it goes dark. It starts getting darker and darker as the evening, as the sun goes down. Okay, and that can help you, and special for people who suffer with SAD, or you can literally get the light boxes that you sit by and just get the rays off there for a bit. Okay, listen to the Calm apps. The Calm app has got meditation on there, and it has sleep stories, different things like that. It really is a nice app to try, so I do recommend that. Yes, it is payable. Yeah, you can check out different types of, packages and offers that they do. There is a few things on there that are free though, so okay. Right, so then that leads me on to meditation. So YouTube, I've got some good sleep stories as well, some good meditation, some wonderful people. Jason Stevenson is absolutely amazing. I love him, he's brilliant. Okay, and you can listen to ASMR on YouTube. I don't know whether you've seen that. It's Autonomous Sensory Meridian Response. There's some amazing YouTubers on there. I recommend you check out Be Brave, BU ASMR. There's several others which are amazing too, so highly recommend. Different kind of visual and sound therapies to help relax your mind and make you, feel better, help you sleep, and can give you tingles. So it's very nice, very relaxing. Try to take a nice relaxing bath if you can, okay? Try to walk, keep active, do some exercise. Try to get out as much as possible in the sunlight, as I said. You sit near windows, as I said. Eat healthily, balanced. Try to talk to people about how you're feeling. Therapy, which I'm putting you for. CBT, which we're doing that. And antidepressants, which I'm doing that. And then some breathing techniques, which I'll just quickly show you how to do that. And then I'll let you on your way. I know it's been quite a long appointment, but I think you needed it. Yeah. Okay, so you can do a thing called breathing exercises. There's different kind of patterns. Okay, so if you see here, you've got your aim to do 4, 7, 8. So breath in for 4, hold for 7, out for 8. That's quite extreme. So I'd start probably deep breath in for 4, hold for 5, out for 4. Okay, but you can just work your way up, whichever's, best for you. Okay. So start by breathing gently. So just breathe normal. If you can do it with me. Okay. Normal breaths. Start to take it deeper. Build it. Get deeper each time. Keep your eyes open or shut. Make it a bit more deeper. Okay, do that for me. Keep the nice flow. Okay, we're going to breathe in for 4, so 1, 2, 3, 4. Suck it in for 4, then we're going to hold it for 5, and then we're going to blow out for 4. Okay, we're going to do that together. We're going to do that 2 times. Okay, let's do this together. Okay, I'm going to start. Ready? In. Hold it. It's a little bit difficult when I'm trying to breathe and then show you on my fingers as well. So let's do from the beginning, okay? We're going to start normal breathing. We're going to go deeper, okay? And then we're going to go into our 4, 5, 4, okay? Good. So we're going to do the control breathing. We're going to do twice, okay? When I go like that, that's when we're going to swap. Okay, so we're going to do normal, getting deeper and gradually getting deeper for a few, and then I'll go like this again, and then we'll go into the full blown, and we'll do the 2 controlled, and then we'll stop, and then I'll let you on your way, and then you'll get all your appointments sent out to you, and I'll phone you with the blood results. Okay, and then when you go, you can book an appointment for 6 weeks' time. Okay, so let's finish off this session with some nice breathing. Okay, let's start normal breathing. Let's take it deeper. Getting deeper. Let's go to the controlled. And again. Okay. How did you feel after that? What do you think when doing it? It's quite nice, isn't it, to just focus on the breathing rather than focusing on what's going on in your mind. Yeah. Yes, definitely. Because you start gradually by normal breathing, start getting deeper and deeper and deeper, and then we go into our controlled breathing for 2. And then I think that's how we should do that. And I think you should do this at least once a day. You pick the time of day that suits you. You can lie down and do it, you can sit up and do it, you can do it how you want and how you feel is best, okay? Yeah, and it's a little bit difficult with the control breathing. It's to get used to the sucking in is for 4, holding it is when you stop, and then as you breathe out for 4. So shall we have one more go? Okay, just relax. You've done really, really well. Okay, normal breathing. Deeper breaths. Start getting deeper. Let's change to control breathing times 2. Okay. You feeling all right? Yes, it makes you feel quite light and quite good. If you can, I'd go and treat yourself for a massage or something like that. Okay. If you can afford to, you go and do that. All right, lovely. It was an absolute pleasure to see you. I'm sorry in these circumstances. Okay, but you can do that, practice that for me. These are yours, a list of how to do the breathing exercises, and then you've got your recommendations there and where to get them from. Okay, yeah, let me just add on the name of Jason Stevenson. He does meditation, and guided meditation is amazing. Listens to relaxation music and things like that. And then you want Be Brave, Be You, ASMR. It's in the name, really. There you go. Have a good read. Please go and get your prescription before you leave the surgery. Alright, so go and book an appointment, get your prescription, take that away and have a look. And if you can afford to get any of those things, please do. It will really, really help you. Alright, lovely. It is my pleasure, honestly. Okay, as soon as you get the referral through, please make an appointment with the psychologist, okay? Unless you decide, like I said, to go private, let me know and I can sort that out. But it will definitely be worth it. Alright, lovely. You take care now. Bye-bye.